everyone. Today we, the nursing tutors, along with the students of Holy Family Institute of Nursing Education, are going to demonstrate the use of personal protective equipment while caring for a patient with COVID-19. It is very essential that we protect ourselves while caring for the patients. We need to use the PPE appropriately and judiciously. So let us begin. Now the preparations that are needed before donning is to change into scrubs, use washable shoes or footwear if available, keep your hair tied up, remove all accessories and jewelry, ensure that you have eaten well and that you are well hydrated, use the washroom if needed before starting the donning. Now let us see the articles that are needed for the procedure. We need a pair of boot cover, leggings over it, a pair of inner gloves, a coverall, surgical mask, goggles, a surgical cap, N95 mask, a pair of sterile gloves and a face shield. We shall now start with the procedure. So the first step is to perform hand hygiene with soap and water. Now we shall sit on a clean chair and wear the boot cover. And then the leggings over it up till the calf muscles. Now wear the inner gloves. The first pair of gloves, which may be sterile or unsterile. Make sure your cuff of gloves goes as far as possible. Now we will wear the coverall. Before wearing the coverall, examine the coverall for any kind of damage, including tears. Now start wearing the coverall. Start by wearing the legs. Then the arm sleeves. And zip up. Cover the zip with flap attached over the zip. Now wear the surgical mask. Now you need to wear the goggles and the surgical cap over it. Wear the N95 mask. Hold like a cup in hand with both the straps hanging out in front. Pull and place the lower strap first, and then place the upper strap above the ear. The most important step is to check that there should not be more than minimal air leakage around the mask when forcefully exhaling. Place the hood of the coverall. covering the forehead and the cheeks. Next, wear the second pair of gloves. Pull them to cover the sleeve cuff and forearm as much as possible. Wear the face shield over the hood and ensure it fits. You are now ready to enter the COVID ward. Now, the student nurse would be demonstrating how to perform the doffing procedure. Articles needed for doffing are a pair of clean gloves, alcohol-based hand rub, alcohol disinfectants, swabs, a contaminated chair, and waste bins. A red bin, yellow bin, and a black bin. Now, preparation. Before leaving the patient room, inspect yourself for any visible contamination. If present, wipe with a disinfectant. An assistant healthcare worker should be present and he or she should not touch the PPE. So the first procedure in doffing is to disinfect the outer gloves. It needs to be disinfected with alcohol-based hand rub. Now remove the outer gloves . And then disinfect your inner gloves. Next, remove your face shield by holding it from the back and discard it. Disinfect your inner gloves again. Remove the goggles without touching it on any part of the face. And disinfect the inner gloves again. Remove the hood cover and the coverall. Remove the coverall by touching the inner surface of the suit carefully. Roll out the coverall . Now roll it from each leg . And discard it into the yellow bin. Now disinfect your inner gloves . Now sit on the chair and remove the boot cover . Disinfect the inner gloves . Now remove the foot cover. And disinfect the inner gloves again. Discard the inner gloves and wear new pair of gloves. Now remove the N95 mask without touching the front portion of the mask and discard. Disinfect your new gloves. Now remove the surgical cap and discard. Disinfect your new inner gloves again. Now clean your shoes with the alcohol-based swab. Disinfect inner gloves. Remove and discard the gloves. Now hand wash with a sterilium. And now you can go and take a shower. So this is how the doffing procedure is done. Thank you everyone.